Hello, beautiful nurses and brilliant nurses. How are we all doing, guys? I hope you are doing great. Okay, guys, today we are going to be doing pneumonia station. Yes, we are going to be doing pneumonia mock. You had me mock exam on pneumonia, which includes the assessment, the planning, the implementation, and evaluation, all in one video. Once you watch this video from beginning to the ending, it covers you everything you need to know on APIE station concerning pneumonia. All right, if this is what you like, please stay tuned. Let's dive into what we have today. Okay, remember that assessment we are going to start with is 20 minutes station. Okay, yes, 20 minutes station. So let's dive into what we have today. Okay, I approach my scene. I can see my scene is safe to approach. There's nothing to cause harm between me and my patient. I close nearby curtains and the windows to provide privacy to my patients, and then I do my hand hygiene according to WHO with an ample of gel on my palm to palm, right palm over the left dozen, vice versa, fingers interlace, fingers interlock, fingers interlock, rotational lobbing of the thumb, rotational lobbing of the thumb, tip to the finger, rotational lobbing of the wrist, vice versa. I air dry my hand for 30 seconds. My hands are clean. I quickly carry my question and go through it. And then I approached my patient. Hello, how are you doing? I'm Nurse Gold, one of the nurses attending to you today, okay? So I am here to carry out A to E assessment on you using a holistic approach. Is it a convenient time for you, please? All right, bless you. Okay, my darling, I would like you to tell me your full name and date of birth. Let me quickly reconfirm that with your wristband and paperwork I have here with me. Hope you don't mind if I touch you. All right, okay, your name. Okay, David Green, okay, date of birth, all right, 7/10/1968, 7/10/1968, and your hospital number is 001234, 001234. All right, assessor, I can confirm that I have the right patient. Are you allergic to any medication, lettuce, food, or dressing, or anything at all you would want to tell me? Okay, you are allergic to penicillin and peanuts. Oh, bless you. I can see I'm having here penicillin and peanuts. On your wristband, penicillin and peanuts. Oh, sorry, darling. What reaction do you usually have when you take penicillin and peanuts? Oh, bless you. I'm really sorry about that. Okay. Anaphylaxis reaction here, anaphylaxis reaction. I can also see anaphylaxis reaction here. But don't worry, I'm not going to give you peanuts or anything containing penicillin derivative. All right. You are safe with us. Okay. Bless you. So tell me, my darling, are you comfortable for this procedure or are you in pain? Oh, bless you. Bless you. So sorry, my darling. You are in pain. Bless you. So sorry. Okay. Do you mind if I reposition you? Okay. Can you take in a deep breath for me? Bless you. Sorry, darling. Sorry, dear. If I ask you to score your pain, 0 being no pain and 10 being the highest, using universal pain assessment tool, what will you score it, please? It's 4. Oh, bless you. I'm sorry about that, okay? I'm going to escalate this to the doctor after the assessment. Please, can you be able to bear the pain while I assess you? Bless you. Thank you so much, okay? All right, my darling. I'm going to go and gather my equipment now. I will be back, all right? This is the call bell. In case if you need anything, you can ring the call bell, okay? Thank you so much. So, guys, I quickly do my hand hygiene again. It's an apple of gel on my palm to palm, right palm over the left dozen, vice versa. Fingers interlace, fingers interlock. Channel of no touch, channel of no touch. If finger, channel of release, vice versa. You join my hand protect this. So please confirm that my equipment is well calibrated and then good for me to use. Oh, bless you, thank you. So I gather my equipment to the patient bedside. Hi, David. I am back again. Are you still happy for me to proceed? All right, bless you. Okay, David, I'm going to do your observation now and documents. After, I'm going to explain to you everything that I have done so far, okay? All right, so my darling, which of the hand do you want me to use to check your blood pressure? Okay, here. Oh, bless you. Thank you so much for that. So I'm going to quickly tie the cuff, occupying 80% of your upper arm, 2 to 3 centimeters above the cubital fossa. All right. Bless you. Thank you so much. Done that. Okay, please, my darling. Can I see your other hand? Oh, thank you. I want to check your capillary refill. All right. Thank you so much. Okay, I can see that your fingers, hands are well perfused. Okay, let me quickly take 1, 2, 3, 4, 5, and a return in less than 2 seconds. Bless you. Okay, my darling, I'm going to be putting the probe on your hand now, okay, to check your oxygen saturation level. All right. Thank you. So let me quickly do that. Okay, I can see that the blood pressure has finished reading. So let me quickly document that. So I am having 130/80 mmHg. All right. All right, I can also see that your SpO2 is 92% on room air. Okay, let me quickly document that on the chart again. All right, bless you. Okay, my dear, I'm sorry, I'm going to be checking your temperature on your skin now. Okay. All right, this is an infrared thermometer. It's just for me to use it and point on your forehead just to check your temperature. All right, it doesn't cause any harm at all. Okay. All right, bless you. Okay, I can see that your skin, there is no sign of infection or inflammation or sweating, so I am happy to proceed. Okay, so I am having that 8.2. Bless you, my darling. I see that you are running a little temperature. Okay. That's 8.2. Let me document that. So sorry, okay. Right there. I'm going to quickly be checking your pulse rate now on your hands, radial artery. Okay. I'm going to do that for 2 minutes. So I would want you to be silent for me for 2 minutes. Okay. Bless you. Thank you so much. Okay, so my darling, I'm so sorry. I didn't tell you I'm going to check your respiration. I checked your respiration for 1 minute and then your pulse rate for 1 minute. You know, sometimes when we tell the patients, they became anxious and it's going to alter the reading. Bless you. I'm so sorry about that. Okay. Oh, thank you. So I get 22 breaths per minute, all right, on your respiration, and then on your pulse rate is 82 beats per minute. Okay, bless you. Let me document that immediately. All right, my darling. So dear, I was actually done for this assessment, but I'm not yet done. Okay, so let me quickly document everything that I've done so far, and then we'll be back to explain it to you. Okay. All right, my dear, I am done. Okay, darling, you know, I checked your blood pressure. It was 130/80 mmHg, which is very okay. And your respiration is 22 breaths per minute. Okay, it's a little bit high. I will escalate this to the doctor. Okay, you're having a new score of 2 on this. All right, and your heart rate is 82 beats per minute, which is very okay. A new score of 0. Okay, and then your SpO2 was 92%, which is having a new score of 2 on my chart, all right, which is a bit low. I will escalate this to the doctor for proper management, all right. And then your temperature is 38.2, which is having a score of 1 on my news chart. Okay, so it's a little bit high, but don't worry, as I said, I'm going to escalate it. Okay, and then the total news score we have is 5. Okay, so I'm going to escalate you to the doctor and that will be monitoring you every hour. Okay, all right, bless you. So my darling, let me explain everything I've done so far now. Very well. Okay, so I'm going to start from your airway. I can see you have been talking to me clearly. There is no obstruction on your airway, or do you have any obstruction on your airway there? Bless you, there is no obstruction, so I'm good to hear that. All right, move over to B. B is your respiration. You know, I checked your respiration for 1 minute. You are now having a respiratory rate of 22 breaths per minute, which is a little bit high. And then the rate and rating is very okay, but you are using your accessory muscles to breathe, and I can see unequal rising of the chest. Okay, don't worry, I will escalate it to the doctor, but there's no seesaw breathing, there's no wheezing breathing. All right, okay, so my darling, and then I also check your oxygen saturation level, and the time I put the probe on your finger, I checked your oxygen saturation level and it was 92% on room air. I'm going to escalate it to the doctor as well because it's a bit low. Okay, all right, darling. And now I'm going to be moving over C. C is your circulation. All right, you know, I checked your blood pressure on your hand. Yeah, You are having 130 over 85 millimeter mercury, which is very, very okay. Okay, bless you. Okay, so I checked your capillary refill on your finger for 5 seconds. Yes, and it returned in less than 2 seconds. Okay, there's no sign of cyanosis. You are well perfused. All right, nothing to worry about that. Okay, bless you. Okay, my darling, I also checked your pulse rate for 1 minute. Okay, I counted your pulse rate for 1 minute, and we are having 82 beats per minute. The rating is perfect, the depth is okay, and the regular is fine. Okay, bless you. And then I'll move over to D is your disability. Okay, so tell me, darling, do you know where you are? Bless you. You are in the hospital. I am happy about that. You know where you are, okay? And then also, do you know who is talking to you? Oh, yes, I am your nurse. Thank you so much, David. You are oriented to place and person now. Okay, you know the time of the day we are now? Oh, thank you so much. That is morning. You are very, very correct. That shows you are well oriented to time, place, and person. Nothing to worry about that, all right? So, you told me earlier that you are having pain with a pain score of 4. Are you still having pain? I'm sorry to ask you again. Are you still in pain? Oh, bless you. If I ask you to score it again, 0 being no pain, 10 being the highest, using universal pain assessments tool, is it still 4? Oh, it's still 4. I'm sorry, my darling. Don't worry. I'm going to manage your pain very well. I'm going to plan for it, and I'm going to escalate you to the doctor as well. All right? Thank you so much. Are you still taking a deep breath for me, if you don't mind? Are you comfortable this way? Are you okay? Oh, bless you. Thank you so much for that. Okay. So tell me, my darling, concerning your mobility, how have you been mobilizing? You know, you are having shortness of breath, which is obvious, all right? So I know it's kind of difficult for you to mobilize. How are you mobilizing? Okay, my darling, I'm going to keep call bell closer to you in case if you need anything, all right? You can ring the call bell. We are going to assist you in activities of daily living, okay? Bless you. Thank you so much for that. Okay, dear, has anybody checked your blood glucose level today? Yes, good. Do you know the reading? Okay, 5.5, bless you. That is very, very okay. Nothing to worry about, okay? Because the normal rate is from 4.5 to 8. All right? Good. You are doing very well. All right, today. How are you been urinating? Are you urinating very well? Great, that is good to hear. Is your urine clear? Is it concentrated? Is there any foul smell? Okay, it's very clear, no concentration and no smell, which is good. That shows there is no sign of infection. And are you having pain when you are urinating under your abdomen? Not at all. Oh, bless you. That is good to hear. Defecation, are you defecating very well? No difficulty, no constipation, no diarrhea. That is good. Oh, it's normal. Good. I am happy to hear about that. You are doing so well. All right. Well done, my darling. Okay, my darling, I also checked your temperature the time I used this on your forehead, and your temperature is 38.2, which is a little bit high. All right, and I'm going to escalate you to the doctor for proper management. All right, bless you. Okay, my dear, apart from the part of your body that is obvious to me, and is there anywhere you are having bleeding, bruises, injuries, swelling, or any sign of inflammation, redness, or rashes? Not at all. Bless you. Thank you so much. That is good to hear. All right, my dear. So, dear, I'm sorry again. I know I'm asking too much question, but don't worry. It's just for good, for proper management. Okay. I'm going to be asking you some questions now. So I just want you to answer me, okay? Thank you so much, darling. Okay, I can see that you are admitted with a shortness of breath, which I can see is obvious to me. And then you are coughing with thick green sputum, and there's a diagnosis of chest infection, pneumonia. Am I right? Okay, bless you. I'm sorry about that. Don't worry. We are going to take proper care of you here. All right. Thank you so much. And also, I can see under your past medical history, you are having hypertension, and there is hypercholesterolemia and also stroke. Is that so? Oh, darling, bless you. So sorry about that. Okay. And then also under your history, you can see that you are living alone, but with your dependent son, Clave, who has learning disability. But your sister, Darcy, is next of your king, and he helps you occasionally. Is that so? Bless you. Okay, that means she is helping you out with your son. Okay, that is good to hear. That is good to hear. Do you mind if I also refer you to occupational therapy? They might be of help to you. Okay, I should do. Oh, bless you. Thank you so much. All right. Thank you. And then also, I can see that you are smoking 20 per day since your teenage age. Is that right? Oh, bless you, my darling. So, David, have you ever think of quitting? You have. Oh, that is good to hear. So then, do you mind if I refer you to smoking cessation unit because we have one in this hospital? Good. Thank you so much. I'm going to definitely do that. All right. Okay. We are moving forward. Okay. And then I can also see that you are taking alcohol 2 to 4 times per month, and that is about 10 units at a time. Is that so? Oh, bless you. So, my darling, sorry to ask you again. Have you think of quitting the alcohol? No, oh, it's fine. It's okay, darling. Just take your time, okay? Just take your time. Just know that we have alcohol sedation units in this hospital. But whenever you are ready to do so, just let us know. We can refer you to them, okay? Bless you. All right, there. I can also see that you are taking medication, Ramipril 5 milligram once daily, and simvastatin 10 milligram once daily, and then levothyroxine 100 microgram once daily. Is that so? So tell me, darling, how have you been managing your medication? Oh, you are doing well. You are keeping up to the regimen. You're not missing it at all. Okay, thank you so much for that. Okay, that is good. Keep it up, okay? And then you're drinking of water. How have you been drinking? Are you drinking well? You know, you are meant to be taking at least 2.5 liters of water in a day. So, how have you been coping with that? You are managing. Oh, bless you. I'm going to also encourage you on that. And you're feeding, because I know you are having shortness of breath and pneumonia. I know you might not be feeding very well. And you mind if I refer you to dietitian? They can be of help for the management. Oh, bless you. I will do that. Okay. I'm going to definitely do that. Okay. Bless you. All right, my darling. Thank you so much. I think I have done, we are done with this assessment. And then concerning your sexual life, your religion, anything at all you want to tell me, anything that is going to be useful to us? Nothing at all. Oh, thank you so much for your cooperation. You did so well. Okay, don't worry. I will escalate the shortness of breath to the doctor and the pain you are having and the temperature. Okay, and also the SpO2 that is a bit low, all right? And then I'm going to plan on the pain and also on the shortness of breath, okay? Bless you. Thank you so much for your cooperation. I appreciate that, all right? So I'm going to quickly clear my equipment now, David. Thank you. So, David, in absence of no further question, this is the call bell. In case if you need anything, David, you can ring the call bell. All right. Bless you. So I'm going to open the curtains and windows and then do my hand hygiene again according to WHO with an unplugged gel on my palm to palm. Right palm over the left dozen, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational opening of the thumb, rotational opening of the thumb. Tip to the finger, tip to the finger. Rotational opening of the wrist, vice versa. My hands are clean. Thank you. Guys, that is it. That is it, guys. You can see how simple it is. You just have to be free. Okay, be free with your patients, be happy, yes, smile. It's not a dead zone, it's exam. I wish you all the best in your examination, guys. The only thing you need to do to make sure you are practicing and practicing. Make use of your toy, make use of your child, make use your husband, anybody, anything usable, you can use it to practice this examination. The major thing is to pass your exam at the end, and that is my wish to every nurses out there preparing for this examination. Okay, now we are going to go and do our planning. Yes, our planning, you can see that our patient is having pain with a pain score of 4. Okay, and then she is also having shortness of breath, which is a result of pneumonia, chest infection. Okay, so we are going to plan on these 2 things. Okay, guys, our nursing problem number 1 is David is having shortness of breath with a respiratory rate of 22 breaths per minute. Our nursing aim is David will breathe at ease with a respiratory rate of 12 breaths per minute to 18 breaths per minute after nursing intervention. The evaluation day. Mr. David will be evaluated today, 10/2/2022, every hourly and as clinical condition changes. Explain all aspects of care to David and gain consent for all the nursing intervention. Monitor David vital observation every hourly as per new score of 5 and escalate according to NIST policy. Assess David respiratory pattern, which includes the depth of breathing, use of accessory muscles, and escalate to the doctor. Teach David deep breathing exercise, adequate repositioning to enhance lung expansion. Teach David the side effects and indication of his do prescribed medication. Administer Mr. David do prescribed medication and monitor its effectiveness after 30 minutes of administration. Refer Mr. David to respiratory team and medical team for expert management. Inform Mr. David to make use of the call bell and ensure that the call bell is at his break. Document all the nursing care rendered to David with date, time, and sign. The second nursing problem now is pain. Mr. David is experiencing pain with a pain score of 5 out of 10. Mr. David will verbalize reduced pain after nursing intervention. Mr. David will be evaluated today, 10/2/2025, every hourly and as clinical condition changes. Nursing intervention. Explain all aspects of nursing care to Mr. John and gain consent for all the nursing procedure. Monitor Mr. John vital observation every hourly as per new score of 5 and escalate according to NIST policy. Assess John's level of pain using universal pain assessment tool and escalate accordingly. Teach John pain relief techniques such as deep breathing exercise, appropriate repositioning, and diversional therapy to reduce pain and promote comfort. Teach John the indication and side effects of his do prescribed medication. Administer John's do prescribed medication and monitor its effectiveness after 30 minutes of administration. Refer John to pain management team and medical team for expert management. Inform John to make use of the call bell and ensure that the call bell is at his reach. Document all the care rendered to John with date, time, and sign. That is it on the planning, guys. We are moving over to medication administration, which is implementation. I approach my scene. I can see my scene is safe to approach, nothing to cause harm between me and my patient. I close nearby windows and curtains to provide privacy to my patients. And then I quickly do my hand hygiene according to WHO with an ample of gel on my palm to palm, right palm over the leg dozen, vice versa. Fingers interlegs, fingers interlock, fingers interlock, rotational of the thumb, rotational of the thumb, tutory finger to the wrist, rotational of the wrist, and vice versa. I handle my hand for 30 seconds, my hands are clean. I quickly read my scenario and approach my patient. Hello, I'm Nurse Gold, one of the nurses attending to you today, okay? So I am here to administer your due prescribed medication, which is due on my time on 16:00 hour, okay? Is there a complaint time for you, please? All right, my dear, please, can you tell me your full name and date of birth? Let me quickly confirm that with your wristband and paperwork I have here with me. Hope you don't mind if I touch you, please. Okay. Green David, date of birth 7/10/1968, and your hospital number is 001234. Okay, so I have here with me Green David, and date of birth is 7/10/1968, and your hospital number is 001234. All right, assessor can confirm I have the right patient. Do you mind if I call you David? Oh, bless you. Okay, David, are you allergic to medication, latex, food, or dressing, or anything at all you would want me to know? Bless you. So you are allergic to penicillin and peanuts. Okay, I have here penicillin and peanuts. On your wristband is penicillin and peanuts. Okay, David, what reaction do you usually have when you take penicillin and peanuts? Okay, anaphylaxis reaction on both of them. Okay, I can see anaphylaxis reaction, and also anaphylaxis reaction. Bless you. That's why you are putting on a red wristband. Okay, I'm so sorry, David. Okay, I'm not going to give you anything peanuts or medication like penicillin. I'm so sorry, David. Okay, I'm not going to give you anything peanuts, all right, and also medication that contain penicillin derivative, all right. Okay, bless you. Are you happy for me to proceed with this procedure? Okay, David, bless you. Thank you so much for your cooperation, all right. So, David, tell me, are you in pain? Are you comfortable for this procedure? Oh, bless you. You are in pain. Oh, I'm so sorry about that. Okay. Okay, if I ask you to score your pain, 0 being no pain and 10 being the highest, using universal pain assessment tool, what are you going to score it? 4. Oh, bless you. You mind if I reposition you? Bless you. Are you taking a deep breath for me? Bless you. I'm so sorry about that, all right? But don't worry. I'm going to check if you have any pain prescribed medication for you. I'm going to dispense that and bring that for you to take. Okay? Bless you. So, David, I'm going to quickly go and bring my trolley for medication closer to you. Okay? I'm going to be back, and also I'm going to also read this medication chart loudly so you can hear me before I dispense it, and teach you the indication and side effects of this medication before I proceed in administration. Okay? Oh, bless you. Thank you so much for your cooperation, David. All right, so I quickly do my hand hygiene again. With an apple of gel on my palm, on WHO, palm to palm, right and wide leg dozen, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotational lobbing of the tongue, rotational lobbing of the tongue. Tip to the tips to the finger, rotational lobbing of the wrist, vice versa. I dry my hand for 30 seconds. My hands are clean. So guys, let me just assume that this is my medication trolley here, just really need to the patient bedside, all right? Okay, David, I'm going to be reading prescription charts now, all right? So I have here with me medication prescription chart for David Green. Date of birth is 7/10/1968. Hospital number is 001234, and ward is a medical assessment unit. Date of admission is today. Height is 1.70 and weight is 85 kg. Body surface area not given. Consultant is Dr. Kane and time of admission is 10:00 hour. So I'm going to be flipping over this record chart and be sure that I have the right medication charts, okay? Still having the same patient detail, David Green. Still having the same patient detail, David Green, David Green, David Green, David Green. Okay, on the last one, David Green. Date of birth is 7/10/1968. Hospital number is 001234, and ward is MAU, and the date of admission is today. Height is 170 and weight is 85. Body surface area not given. Consultant is Dr. Kane and time of admission is today. Assessor, I can confirm that I have the right patient's prescription charts. Okay, I am happy to proceed. So all prescriber must complete the signature record. I have here a Bollard NMC number is 654298 and signature is Deborah and BIP number is 6853. All right. Assessor, I can confirm that this medication chart is eligible, complete, and valid for me to proceed. I am happy to proceed. Okay, so and then moving over to the next one, detail of the person administering this medication. I'm going to come back to sign this area, and then moving over to the next one, allergy. I have medication penicillin. Effect is anaphylaxis, and another one is peanuts, and then effect is also anaphylaxis. And He has been signed by Dr. Ebola, and BIP number is 6858 and date is today. Okay, moving over to the next page, still having the same patient detail, I have here information for prescriber, which is I'm going to make use of as I am proceeding. And then I also have here once only medication. Date is today, drug is paracetamol, dose is 1 gram. Route is IV, instruction is for pain, time required is 800 hour, and the time of giving is 1000 hour, which has been signed by the person that administered this medication. Prescriber signature and BIP number is Dr. Eborad, and BIP number is 6858. I am happy to proceed, and also still having another one for today. Is ondansetron, dose is 4 milligram, route is IV, and the instruction is for nausea. Time required is 800 hour, and time of giving is 1405 hour. And it has been signed by the person that administered this medication. And then the signature and BIP number for doctor is Dr. Eborad, and BIP number is 6853. I am happy to proceed as this medication has already been administered. Moving over to the next page, I have prescribed oxygen via nasal cannula 2 liters. Date is today. Time is 900 hour to 1100 hour, and then the frequency is 2 liter via nasal cannula, and signature of the person that administered this medication is here. This medication has been administered and been signed, and BIP number and doctor's name is also here. So I am happy to proceed to the next one. Moving over to the next page, I have here antimicrobials. The medication is amoxicillin. Date is today, dose is 500 milligram, frequency is TDS, route is P oral, duration is for 7 days, time is 1600 hour, and date is today. So this medication is due on my time. Start date is today, finish date is for 7 days. Prescriber signature and BIP number is Ebolad 6853, and print name is Dr. Ebolad. This medication is due on my time assessor, but because my patient is allergic to penicillin, I am not going to be administering this amoxicillin. Okay, I will escalate this to the doctor to prescribe another type of antimicrobial to my patients. Okay, so David, I'm sorry, you are having amoxicillin prescribed for you today, but as I can see that you are allergic to penicillin. This amoxicillin is a penicillin derivative. I'm sorry, I will not be administering that to you. Okay, I'm going to escalate this to the doctor to prescribe another type of antibiotic for you. All right, bless you. Okay, so moving over to the next one, there is no more prescribed antimicrobial for today. Moving over to the next page, regular medicine. Number 1 is ramipril. Date is today, dose is 5 milligram, frequency is once daily, route is P oral, duration is continuing, start date is today, finish date is continuing, prescriber signature and BIP number is Ebolad 6853, and print name is Ebolad. Assessor, this medication is due on my time. Assessor, please, can you confirm my patient's heart rate and the blood pressure level is within the normal range? Oh, bless you. Thank you. Okay, David, you are having ramipril today, and this medication is used for management of your blood pressure. All right, and side effects you can have is low BP, nausea, and vomiting. Don't worry, I'm going to be here to be assessing you after 30 minutes of taking this medication. But if anything should happen before then, you can make use of the call bell. Okay, bless you. Thank you so much. So, assessor, I'm going to be dispensing this medication now. So I have here with me ramipril, and then dosage is 5 milligram. I have here 5 milligram, and the expiry date is 10/2/2027. It's still valid and intact, and I am happy to proceed. So I'm going to quickly dispense this medication, 1 tablet of this medication now. So, and then I return it into the trolley. All right, so moving forward to the next one, David, I am having here today is levothyroxine, and that is today. Dose is 100 microgram. Frequency is once daily. Route is per oral. Duration is for 7 days. Start date is today. Finish date is for 7 days. Prescriber signature and BIP number is a bullet 6853, and print name is a brand, and time is 1600 hour. Is due on my time. Okay. Sorry to ask you, David. Have you taken anything today? Have you eaten something today? Not at all. Oh, bless you. You know the reason why I asked, this levothyroxine is used to monitor underactive thyroid gland. All right. And then the side effect can be nausea and vomiting. But don't worry, as I said, I'm going to keep reassessing you. Okay. But if anything should happen before then, you can ring the call bell. All right. Okay. And then the reason why I asked if you have taken anything is that this medication is taken on empty stomach. Okay. Then you can eat something from 30 minutes to an hour after taking this medication. All right, bless you. Okay, so are you happy to take this medication, David? All right, thank you so much for that. So I'm going to quickly dispense the medication now. Okay, so I have here with me levothyroxine on my paperwork, levothyroxine, and 100 microgram per tablet. Then my paperwork, I am also having 100 microgram, and the expiry date is 10 to 2028. It's still valid and intact. I am happy to dispense. So I'm going to quickly open it up and take one tablet of this medication, levothyroxine. Here, put it into another cup and close it into the trolley. Okay, David, we are still moving forward to the next one. I have here simvastatin, and date is today. Dosage is 10 milligram. Frequency is once daily, and the route is per oral. Duration is continuing. Time is 1200 hour, and prescriber signature and BIP number is a bullet 6853. This medication is not due on my time. I am happy to proceed. Okay, still having the same patient detail, I have as required medicine, paracetamol. Okay, so that is today. Dosage is 1 gram. Frequency is 4 to 6 hourly. Route is per oral. Duration is continuing. There's no start date, there's no finish date. Okay, prescriber signature and BIP number is a bullet 6853, and print name is a bullet. So David, this medication is for management of pain. Okay, you told me earlier that you are having a pain score of 4. Are you still in pain? Oh, bless you. I can see that you take this medication under once only medication, if I'm correct. Yes, I can see you take it under once only medication. Okay, and it's about 10:00 hour you took it, and now it's 4, which means we are having 10, 11, 12, 1, 2, 3, 4. Good, which is very good. Okay, so I'm going to quickly dispense this medication. All right, you can have you might have side effects like nausea and vomiting, but don't worry, as I said, I'm going to keep reassessing you. Okay, so are you happy to take the medication paracetamol to relieve your pain? Oh, bless you. Thank you so much for that. So I have here on my hand paracetamol, and then dosage is 500 milligram per tablet, and I am having to give 1 gram, which shows that I'm going to be taking 2 tablets of this medication. Expiry date is 10 to 2029. It's still valid and intact. I am happy to dispense. So I quickly bring it out, 2 tablets of this medication out. Okay, so moving over to the next page, I have infusion. There's no prescribed infusion and omitted dose. So I'm going to come back to document the amoxicillin that I omitted and the reason why I omitted it. Okay, so that is it. Okay, I am done. I'm now going to move back to my patients. with my medication. Hi, David. I am back again. Are you still happy to take your medication, David? Bless you. Okay. So, David, please, can you still tell me your full name and date of birth? Let me quickly reconfirm that again with your wristband and paperwork with me before I give you the medication. All right. Just to be sure that I have the right patient. Okay. Oh, bless you. So, David Green, and date of birth. Okay, 7/10/1968, 7/10/1968, and your hospital number is 001234, 001234. Bless you. I can see I still have the right patient. Okay, so David, are you allergic to any medication, latest food or dressing? I'm so sorry, I know I have asked you earlier, but I just wanted to confirm again. Okay. Oh, bless you. You are allergic to peanuts and penicillin. I can see I have here peanuts and penicillin, and on your wristband is peanuts and penicillin. Bless you. What reaction do you usually have? Anaphylaxis in both of them. Bless you. I have here anaphylaxis reaction in both of them. Anaphylaxis reaction, anaphylaxis reaction, anaphylaxis reaction. Bless you. I can see that's why you are putting on a red wristband. Bless you. So sorry about that. All right. Oh, good. So are you still happy to take your medication, David? Bless you. Okay, David, I'm so sorry to ask you again. All right, so I would want you to, can you help me to take a sip of water just for me to assess your swallowing ability, if you don't mind? Bless you. Thank you. Have you swallowed? Can you do Oh, good job. Thank you so much, my darling. So here I have levothyroxine here. Okay, thank you. Can you take? Bless you. Can you take a sip of water for me? Thank you so much. Swallowed. Lovely. Thank you, my darling. I appreciate that. Okay. So the second one we are having is your paracetamol, which is 1 milligram. Okay. Here. Management of pain. Okay. Here. And this is a cup of water. Can you take a sip? Bless you. Have you swallowed? Thank you so much, my darling. And this one is for blood pressure monitoring, as I explained earlier. Okay. Is Lamiprio 5 milligram. Okay. Here. Can you take a sip of water? Bless you. Good job. Can you drink a little more? Can you take a little more? Bless you. I'm going to encourage you to always take adequate food intake, at least 2.5 liters in a day. Okay. So we are done with your medication administration. Bless you. Thank you so much for your cooperation. All right. I'm going to come back to reassess you after 30 minutes of taking this medication. All right. So let me quickly do my documentation now. So I'm going to sign on all the medication that I've given. Under amoxicillin, I signed that I put my date under today, and I put code 10. My patient is allergic to penicillin. I quickly move over to omitted medication and also charted it that my patient is allergic to penicillin under coding. Okay, the time of giving is not given, guys. That is it. Okay. Okay, David, I'm done with the medication administration. Okay, do you have any question for me, darling? No question. Bless you. Thank you so much for your cooperation. Okay, so this is the call bell. In case if you need anything, you can ring the call bell. I'm happy to attend to you. All right. Bless you. Thank you. See you later, darling. So guys, that is it. We are done with medication administration and the signing. Remember that David is allergic to penicillin, and the penicillin was administered initially by the first person that gave this medication. Yes, someone administered this medication in the morning by 8 o'clock, and she administered this amoxicillin. So remember, we need to escalate this when we are handing over, and also escalate it to the doctor. Good. So let's move over to handing over of our patients. So guys, remember that evaluation is 8 minutes procedure. We are handing over to your assessor. Okay, my scenario is that David Green is being transferred to discharge lounge ahead of his discharge home later this evening. His pneumonia is being treated conservatively. So I am now going to hand over this patient to a discharge lounge nurse. All right. Hello, I'm Nurse Gold. I am coming from Medical Assessment Unit. I am here to hand over my patient. Are you a nurse from Discharge Lounge? Nice to meet you. Okay, so I am here to hand over my patient, David Green. Date of birth is 7/10/1968, and the hospital number is 001234. Height is 1.70, weight is 85, and consultant in charge of him is Dr. Kane. Time of admission is 10:00 hour and date of admission is today. Okay, so he is allergic to penicillin and peanut, and the reaction for both of them is anaphylaxis reaction. So David Green was admitted today with a presenting complaint of shortness of breath, coughing with the thickened green sputum, and he was diagnosed chest infection, which is a pneumonia. His past medical history is hypertension, hypercholesterolemia, and then stroke. He lives alone but with his dependent son Claire, who has learning disability. Okay, and her sister is now taking care of him as he is in the hospital. Okay, so David smokes 20 cigarettes per day since teenage age. He also takes alcohol 2 to 5 times per month, about 10 units at a time. All right, and his medication is ramipril 5 mg once daily, simvastatin 10 mg once daily, and levothyroxine 100 microgram once daily. And as I said earlier, he is allergic to penicillin and peanut, and reaction is anaphylaxis reaction. So A to E assessment was done using holistic approach. During the assessment, and then his blood pressure was 130/85 millimeter mercury, which is very okay. SpO2 was 92% on room A, okay, which was escalated to the doctor. And then his heart rate was 82 beats per minute, okay, with a good written strength, and the regular, it was regular. All right, and then also the respiration was 22 breaths per minute, which was escalated to the doctor for proper management. And then the temperature was 38.2 degrees Celsius, which is a bit high. All right, so in total he's coming out with a new score of 5, which was escalated to the doctor and monitor hourly. So currently his new score is now 0, with David temperature is now 36.9 to compare to what it is before. It was 38.2. Okay, you can see he's doing well, and pulse is now 90 beats per minute, but previously it was 82 beats per minute, and respiration is now 20 breaths per minute, but initially it was 22 breaths per minute. Okay, and oxygen saturation level is now 96%, but initially it was 92% under room air. Blood pressure is now 150/85 millimeter mercury. Initially it was 130/85 millimeter mercury, and he's now having a new score of 0, which shows that he is doing very well. During the assessment, nursing problem that was identified is a difficulty is in breathing, which was well managed with adequate repositioning and deep breathing exercise, and it was quite helpful. All right, and then also he was complaining of pain with a pain score of 5, which was well managed. Now he's doing very well and reduced pain, okay, was managed with deep breathing exercise, diversional therapy, and adequate repositioning. All right, so during medication administration, amoxicillin was prescribed for him, but I couldn't give it because he is allergic to penicillin. All right, and then also ramipril was administered 5 mg, and also levothyroxine was also administered. Okay, he is doing quite well now, unlike before. So my concern now is that I noticed that amoxicillin, which David is allergic to, was administered by 8 o'clock hour. And please, I wouldn't want you to escalate this to the doctor. Okay, so let him prescribe another type of antibiotic to David, as you know that he needs antibiotic because of a chest infection. All right, okay, bless you. And then also I would like you to also continue monitoring him until discharged. Okay, and then he also agreed for us to refer him to a smoking cessation unit. Okay, I would want you to also do that. All right, and he said he's going to let us know when he will be ready to quit the alcohol intake. Okay, so do you have any question for me, please? All right, thank you so much for your cooperation. I appreciate that. Thank you. This is it, guys, on handover, which is evaluation. Evaluation is just for you to say everything that you have done for this patient. That is it. You are handing over this patient using ESBA. I'm going to do a video on this in detail. All right, just watch out for the video. Thank you so much for watching this video so far. Please, if you have gotten value on this video, still remember to subscribe, comment, like and share this video to all the beautiful nurses out there that is preparing for their OSCE examination. Congratulations for passing your OSCE. See you guys on my next video.